It's just so powerful, when you see people and, are they doing the best that they could be doing? Everybody's going to have a different opinion, but I'll tell you, when you see people out and they've made changes in their life and they're feeling good about themselves, that just says it all.
I think often they don't feel accepted within the community, and that's really hard on them, and you can see the struggles they go through because of that.
With the residents that we have coming through our doors here, it's offered hope that we have been making steps as a community in the right direction to help to address some of the mental health needs in our community.
CMHA Kenora is a mental health and addictions organization that services the Kenora Rainy River District that provides mentally healthy services for individuals in an inclusive society. We're responsive in our delivery of services to individuals, and that if we're not able to provide the right services to people, we ensure to link individuals to those appropriate services in our community or in the Northwestern Ontario area.
In the past year and a half, we've actually almost doubled in size, just with the addition of our rent supplement program, our Safe Bed program, the mobile crisis response team, and as well as the Kenora Emergency Shelter and the Service Hub.
I was amazed and delighted when I became a full-time employee of CMHA to realize that the needs of mental health are being met through this organization. The needs of our vulnerable population are also being met.
Safe Bed is exactly what the name implies. It's safe, and it's a place for you to come and rest and really plan and stabilize and figure out what's going to work for you and talk about what hasn't worked in the past.
The first time I came to Safe Bed, I was experiencing a mental health crisis, and I was using a lot of anti-anxiety medications to cope with that, and I was very, very distraught, and I came into this place and it helped me.
You hit rock bottom and you got nowhere to go and no one to turn to and no one to help you, and the Safe Bed program took me out of crisis, get you back on the right track and kind of point you in the right direction.
The Kenora Emergency Shelter is vital for our community. We need the safe and accepting and inclusive environment for the vulnerable population. We need somewhere for them to go and feel welcomed and safe.
Our program here at the Clinical Service Hub, we're going to try and bridge the gap and offer clinical services to a marginalized and vulnerable population where they may have slipped through the cracks in the mainstream systems that are currently in place here in Kenora.
The long-range goal of this program that we have here is to get people into housing and to support them when they are in their housing.
The Mobile Crisis Service in Kenora is actually a new program as well, where we actually partnered with the Ontario Provincial Police.
When you look at the dynamics of the city of Kenora, the mental health, the addictions issues, we really took a hard look at implementing this program. And it wasn't shortly after this program started that we said, this is exactly what we need to focus on.
With this job, you're actually able to spend time with people. You might have 20 contacts with them in a month or more. You're actually spending the time to answer their calls, answer their questions, take them for coffee, learn about them, learn their families and what struggles they've gone through. So
it's about visibility. We're out there all day making contact with people. I think it's very helpful for people who are maybe having a hard time with mental health and a hard time with addictions, to have somebody that they can go and talk to who can then help them make contact with some more longer term services.
We support individuals who are involved with the justice system and they have a mental health diagnosis as well. And they are either homeless or at risk of becoming homeless. We support them with finding suitable housing.
And we help to provide the supports that they need and provide them with the extra supplement to be able to afford safe living environments.
things are in place. The resources are here. The programs are here. If people are able and willing to access them, the support is here. And I see it in our case managers, the dedication and the passion that they have for their job and for their clients.
I'm just gonna continue doing my best here. Like, I love working with these guys. They give me respect, and when I bump into them on the streets, they say hi. I'll say hi. And it makes me feel like I belong. Like I'm meant to be here.
It's nice to know that when they're leaving here, they had somewhere safe to be, and warm food, and a welcoming environment.
Had nothing but positive experience here. I have nothing but good things to say about the workers personally. I think they're all angels myself. Like it's like a place that saved my life.
You just can never give up. You've got to just keep on going. Our clients haven't given up, so we need to be there and support them and help them.